We were thinking they were gonna go in and do brain surgery. So the fact that they told us they were gonna go through a vein in his groin, that put us at ease quite a bit.
Coming up, a doctor reaches inside a 2-year-old's brain without ever making an incision in his head. Why little Camden had to be flown to Kansas City, though, for his care. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. A child's brain is an amazing thing. Case in point, 3-year-old Camden Gay. He suffered a series of strokes earlier this year, but you can't really tell based on his movement and energy here. Here's Janine Keesling with more.
Like any 3-year-old, Camden Gay loves the park. He loves to swing. He loves to slide. He loves to drive.
Beep, beep, beep.
But Bruce and Amy Gay treasure these moments more than most.
Myself, I was scared for his life at that point.
Because when Camden was just 2.5 years old, he suffered a series of strokes from a condition called cerebral venous sinus thrombosis, or CVST. A blood clot forms in the brain's venous sinuses and prevents blood from draining out of the brain.
He wasn't doing anything, just laying on the couch, and I gave him a drink and he started, I didn't know he was seizing up, but that's what he did.
Amy rushed Camden to the local hospital in Pittsburg, Kansas. Doctors told Amy Camden was anemic and needed specialized attention, so they were flown to Children's Mercy in Kansas City. It was there Amy and Bruce learned their toddler was in serious trouble.
The first time I had seen my son since here in Pittsburgh, the right side of his face was twitching and his right hand was twitching because he had just had a stroke.
Doctors at Children's Mercy knew Camden would need surgery to remove a large clot in his brain, and time was critical. Camden was transferred to the University of Kansas Health System.
Well, the first surgery, they went in through his groin and went all the way up into his brain to try and knock the blood clot loose. They went back in through his groin again and actually went past the blockage and blew up a little balloon and pulled it back through.
Doctors told Bruce and Amy the multiple strokes damaged 20% of Camden's brain. But with his age, they believed Camden could learn to walk and talk again using a different part of his brain.
What color swing you in? Blue. Good job.
Their main concern was his physical ability, but he was doing everything he should be physically.
Good job. He's still behind, like on the speech, but everything else, they said he's perfect.
They definitely did amazing at treating our son.
He's smiling.
They saved our son. That's all that mattered to us, for sure.
You having fun, Bubba?
No.
No.
And we are so happy to have Bruce and Amy Gay joining us from Pittsburg, Kansas this morning, along with Camden, too. How are you guys doing today?
We're good.
Good. Good to see you. Thanks for getting up early with us. We're looking forward to hearing more about your story. And in just a few minutes, we're going to be talking to these two experts, Dr. Michael Abraham. He is a neurointerventionalist here at the University of Kansas Health System. And Dr. Abraham, you've been on the program before to kind of explain this special way that you take these blood clots, these treatments, take the blood clots out of the brain. So we're going to explain kind of how you did this in Camden's case. Also, welcome back to the program, Dr. Sean Sood. He's a pediatric critical care specialist working with kids in our pediatric ICU unit. How are you?
Doing well, thank
Good
you.
to see you guys. I know it's kind of exciting to see Camden doing his thing.
Oh yeah.
Pretty nice, huh?
Yes.
Yeah. So I want to ask you both how his recovery has been. He was in the ICU for 7 months. Camden doing pretty well?
Yes, he's doing good. Back to his normal self.
That's more than any parent could ask for, back to his normal self. Camden needed to be intubated and heavily sedated for some of his treatment, but once he came off the sedation, how long did it take for him to start walking again? What was that process like?
It was about 2 days. He pretty much, after his sisters, they took him off of the sedation and we called his sisters. and that pretty much woke him up. And then about 2 days after that, we had them come up, and he just ran to them.
So he was back at it with the
Yeah.
sibling love. I love that. So we know that he's done a lot of rehab and physical therapy. What was that experience like? Just, is he still going to physical therapy? And what have those days been like, kind of getting him back on track?
Well, he actually graduated physical therapy. So he's no longer going to physical therapy. They definitely want to keep it in the background, though, in case he needs it again.
Yeah, that makes sense. Tell us a little bit about what it was like, you know, seeing him run around and picking up things and showing you stuff. What was it like to go through physical therapy with your young son?
Well, his physical therapist was amazing. We liked everything about Robert. He did a wonderful job with him. First, you're kind of nervous, but after we kept going, it got easier.
Come on, Bubba.
So we heard you mention in the story that he still has some work to do with his speech. What have you noticed significantly when it comes to that?
Before all this, he was only saying about 4 words, and then now he's saying about 47 words.
That's pretty. The doctors were nodding their head. I take it that's a good sign, right?
Oh, yeah.
What does that mean? Yeah, when you start to see those little milestones, docs, when you, you know, from 4 words to, you know, over 40 words, that's big strides.
Yeah, it just shows us, you know, with the young child's brain, it's still growing, so they haven't made those permanent connections. So with all that recovery, rehab, physical therapy, speech therapy, just showing his brain is continuing to heal, continuing to improve.
Well, yeah, on that note, you know, how does his age contribute to the recovery? Does it make it easier? Is it quicker? What's the impact?
Yes to both. Makes it easier because there's something called neuroplasticity. Like I said, the brain is still forming. There's still things that have not permanentized in his brain. So as his paths are developing and as he's recovering and being that young, it allows him to almost take an insult better than an adult can.
Right. Well, so that on that note, Dr. Sood, if this were to happen to an adult, could the outcome have been much different?
Absolutely.
What would we be looking at?
Yeah, the recovery could be much longer in an adult compared to a child Camden's age, and also the type of recovery and the fullness and optimization of recovery can be very different. And so Camden being younger, just like Dr. Abraham's alluding to, allows him to form new connections in his brain and recover in a much different route than an adult
Yeah,
could.
which is what we see in these videos. So it's so nice to see. Dr. Abraham, just talk a little bit more about this condition, CVST. What is it? Is this rare? Tell us more.
Yes, it is very rare. Out of all strokes, it's about 0.5% of all of them. And it's different than the normal stroke we see, which involves the arteries. Those are what carry blood to the brain, carry oxygen, nutrients. Here, we're talking about the large draining veins. So when you have a big clot sitting in there, that area of the brain cannot properly drain. So you start developing a lot of pressure. The spinal fluid can't drain as well, so people start to become very lethargic. Sometimes people can become comatose and fully unresponsive in very extreme cases. And in Camden's case, his area of the brain where it could not drain, there were strokes starting to develop there because the pressure became too high.
So, Amy and Bruce, what were you noticing? Were you noticing some different types of symptoms? What were you thinking?
Well, I took him to the doctor about the middle of March, and they said it was a viral thing. And then I took him back 2 weeks later, and they said it was the same thing. And then after Easter, I took him to the emergency room because he started seizing up. But he was throwing up, not eating, complaining of his head hurting, and really pale.
So, docs, explain. Bruce, go ahead, please.
And he wasn't wanting to drink anything, eat or drink anything.
Well, yeah, and I guess when we're talking about kids, you just look for some of those very simple day-to-day things that they do. They eat, drink, sleep, they play, they laugh. I mean, and if they're not doing any of those things, parents need to be aware. Having it be mistaken for a viral infection, is that normal? I mean, if a parent notices something, takes them to a hospital, they say it's viral, but should they be asking more questions? How do they know?
So sometimes a viral infection can cause dehydration, can change your coagulation profile as well, and predispose you to a stroke and a clot as well. And so whether he had a viral infection first and then a clot after the viral infection is a possibility, but it's really hard. We don't think about strokes in kids. We just think about strokes and clots in adults. And so if there's one little change in your child, bringing that attention to a medical provider and following your gut is really important. But the segment just highlighting strokes in kids is really important because they do happen.
Yeah, they're rare, but they happen, and people need to know what those signs are. But you're not really surprised that they would have gone to viral
Correct.
before you would go to a stroke. Dr. Abraham, let's talk about what you did to treat this. We want to show some animation here, a procedure where you run a wire through someone's blood vessel all the way to the brain. The common treatment is blood thinners, but we'll talk more about that, but explain what's going on here.
Yeah, so similar to, strokes of the arteries, I went from a vein in Camden's leg, in his groin, and ran these catheters, these long tubes, all the way into the brain, into this clot. And I, like this video is showing, I sucked it out or aspirated some of the clot out, and then I took these other devices called stent retrievers. They are like a stent that you'd put in another vessel in the body, except these ones, they expand in the clot and integrate with the clot, and then we ideally pull the stent retriever with the clot out.
So these blood thinners, so-called clot-busting drugs that you might give someone, why would he also need the thrombectomy?
Yeah, so the blood thinners are the first line of treatment for CVST. And what that does is it prevents the clot from getting bigger, allowing Camden or another patient's own body to break up that clot. But if the patient continues to have more symptoms or is getting worse, then that's when we bring them over and we do thrombectomy on them.
So you shared some images from Camden's treatment.
Yes.
I want to just show some images here on the screen and just kind of tell us what we're looking at kind of from the left to the right.
Yeah, so on the left picture, this is what we call an MR venogram. It's a side view with the left side being the front, and it shows all the veins completely open and normal. You can see those.
The white would be blood flow.
Correct, yeah, those blue arrows. And on the right picture, this is Camden's MR venogram before treatment. You can see those two arrows are pointing to the front part of this very large and important vein where there's no blood flow. You don't see that nice, robust white line there. But in the back part, it's filling.
And is this slow forming? How slow is that forming over time?
Yeah, it's typically slow over, hours, maybe even days as well.
But not really a whole long time. I mean,
Correct.
We're talking a matter of hours or days. So let's talk about what we're seeing here and what you did with the stent.
Yeah, so on the left picture, it's very similar to the MR venograms we just saw, where the left side is the front. And I took my catheter all the way to the front part of this vein, inject contrast dye, and on the left picture you can see there's really no contrast coming back. You see that dark line, that's just my catheter. And then on the right picture, I took 2 stent retrievers. Normally in the arteries, we would typically just take 1 stent retriever. The arteries in the brain are roughly 3 to 4 millimeters, whereas these veins are on average 7 to 8 millimeters, so about twice the size of the arteries. So in his case, I actually took 2 stent retrievers, you can see there, in parallel, just to try to get it more clot out.
It's like a basket. It's hard for people probably to see, but it's kind of like this basket where you're
correct, yeah,
pulling it out through that way,
yeah,
right?
Yeah.
And then we see the blood flow.
Yes.
What's it like working on a child that young and
yeah,
what's the communication like when parents are sitting out waiting to hear from you next?
Yeah, I mean, it's one, especially in Cam's case, he's just so small, half the size of a normal adult that we're, treating and things. So we have to take into account all these things, the size of his vessels, because sometimes we can't use all the same devices we use in adults because it may be too big for the child's body. But, going into these veins, we're being as meticulous as we can just with an adult. Trying to slowly pull this clot out without causing any damage as well.
So Amy and Bruce, when you heard that this is what was going to take place with your son, kind of how were you processing all of that? Did you have questions? I'm sure you did. What was that like for you?
For myself, it was scary. We didn't know whether we were going to have our son or not after the brain surgery.
Amy, how were you holding up?
It was very hard, considering we still had 2 other daughters back home, and I really didn't know what was going to happen.
Yeah, just a completely unexpected scenario. I want to ask Dr. Abraham, because I know you have to leave the show here pretty quickly, but just what do we think caused this CVST in the first place? Where does that come from?
So as Dr. Sood was speaking earlier, sometimes it could start as a viral infection or some kind of infection, and in children, they can become lethargic. They may not want to eat or drink, and with that can lead to dehydration. And it may not be as apparent in a child as an adult. So sometimes that dehydration can cause these clots to form.
Before you take off, just what do you want folks to take away from Camden's story?
Yeah, just like Camden's parents saw, they noticed something wasn't right with Camden. I think that's the most important thing. Know your children, pay attention, just listen to them and observe them. If they're not normal, then you should at least seek, attention with your pediatrician. And then if they need to escalate it, they can escalate it.
Thanks for all the work you do. Thanks for taking the time to be with us this morning.
Thanks for having us.
Good.
You all take care.
Good to see you. All right. So Bruce and Amy, I just want to talk a little bit more about after these procedures. What was the recovery like? How long did Camden stay in the hospital? And just what kind of lay that out for us?
I believe he was in the hospital for about 4 or 5 more days after the surgery. And they pretty much said he was just about in a full recovery by then.
And just what was it like for you, Amy, emotionally? I mean, just looking at this video, I mean, this is the last thing any parent would ever expect to be going through. How were you hanging in there?
It was very hard. It helped my husband being up there with us and talking to his older sisters. It was just a bad nightmare.
It is every parent's worst nightmare. And Dr. Sood, you're no stranger to that because you have to talk to parents and help them kind of navigate through these issues. We know that Camden spent a lot of time sedated. So tell us a little bit about what it's like to sedate and intubate someone so tiny.
Yeah. You have to be very careful with the dosage. And so all our sedation is weight-based. Mm-hmm. So for an adult, it's almost a standard dose. But for a child, based on Camden's weight, you have to use the medications based on his weight. And it's very nuanced. But just like adults can withdraw from sedation, if they're on medications too long, they can have withdrawals. So can children. And so you have to be mindful for how long they're on sedation and their dosages as well. Regarding intubation and ventilation, a child's airway is so much smaller than an adult. That's why we go through different training and have to do so many intubations, in a training environment before being able to do it here as a professional.
Yeah, so no pressure for you, right? You can handle it.
Sure,
you do this. So,
sure.
So I asked them about what the recovery was like for Camden, but what does a typical stroke recovery look like for a child? How long can that be? And what would the follow-up be for something like that?
Sure. So it's all about the pressure in the brain. And so Dr. Abraham's doing his wonderful work to aspirate the clot, but when you do that, there's inflammation and different changes in the pressure in the brain, and you want to keep the pressure in the brain low. And so that's why we do sedation, is to keep the pressure in the brain low and keep Camden calm. And then once we wean off the sedation and we're noticing that he's recovering, we can get the breathing tube out and see how he's doing. But a ICU stay after this procedure can be up to 72 hours, sometimes longer. It just depends on how that patient is recovering afterwards.
Yeah, you're just watching them closely.
Exactly.
Hour to hour, minute to minute. Bruce and Amy, you had mentioned Camden and his older siblings. Just tell us a little bit about their bond and how they all handled this and kind of what maybe some of those conversations were like with them.
Well, one of our daughters, she's like a second mom to him, so she took it pretty hard. Our 8-year-old, she doesn't fully understand what happened.
Yeah, that's a lot. That's a lot to take in for a kid and watching their little sibling go through something like that. Thanks for sharing these really cool videos and pictures. If you have questions for the family or Dr. Sood, go ahead and put those in the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is there on your screen. But it's Friday. Let's check in with Dr. Dana Hawkinson. How are you?
Friday.
I know.
COVID News Day.
Mm-hmm.
Not too much COVID news per se, other than we know. Oh my God. My mic.
No, Mike. I said it's Friday.
I know.
It's,
It's
you're not
Freaky
taking
Friday.
a day off. Nice try, though.
Thanks a lot,
Nice
guys.
try. You've only done that like 3 times in
I know.
3 years,
3 years.
so you're good. You're
I
good.
should have learned by
Yeah,
now.
You got it.
Anyways, again, not too much COVID news. We know that overall vaccine booster updated booster, the uptake is very low, around 3 to 7% of the nation. But we do have 17 active patients in the hospital. That is good. We were up to 22. We're hoping to keep it under 20 and, of course, down to 0 if we can. But we know we are really getting into the throes now of respiratory viral season. So I'll also have to be concerned about RSV, influenza, other common cough and cold viruses as well. But in other news, we do have some other things going on, though, Jessica.
Okay, so all right, keep your mic on because I do have a question for
Yeah.
you. Some stories about pulling some eye drops off shelves. Some of these stores are pulling them off the shelves after this FDA recall. This week, Walmart joined the list, Rite Aid, CVS, Target, other brands. But the FDA found that unsafe bacteria was in the factory where these eye drops were made. There haven't been any reports of injury, but it sounds really familiar to those cases that you told us about in February where tainted eye drops did end up hurting people. Just kind of tell us what this is about.
Yeah, so first of all, I'd like to say that this is one of the good things about the FDA. It is for the public health, just as our public health entities like our state and local health departments are. Their main focus is to keep the public healthy and safe. These are recalled products, eye drops. They should already be off the shelves, but of course people could have ordered them online and may have them in their houses as well. And again, these are only over-the-counter eye drops, so you can buy these just on the shelf. They are not the prescription or medication eye drops. But you do want to check if you have bought some recently. You can go to fda.gov/recalls, and then you can search eye drops. There's also, if you go to FDA press release, it is also there as well. There are many sources where you can look to see exactly what products from those companies there are that could be contaminated. So we are also, like we said, trying to prevent cases of infection. We know that earlier in the year this happened. Those cases earlier in the year involved artificial tears from a couple different companies. Those caused significant infections where 4 people died. Other 4 people actually had to have their eyeballs removed, what we call enucleation. And then, of course, 14 others lost their vision as well. So all of these things add to significant morbidity and mortality. And again, just happy that the FDA is being proactive. This isn't cause to worry anybody, but inform people so that they can be safe and do best practices and keep their family safe as well. If you think that you have concerns about eye drops in your home, you can either look online or even just take those eye drops to your local pharmacy so your pharmacist can take a look at that as well.
All right, Hawk, thanks for that info.
Yeah.
Appreciate it. All right, let's get to some questions from our viewers today. Lynn wants to know, Dr. Suter, are stroke symptoms harder to spot in kids from, not necessarily symptoms at home, but when you come in and are looking for them?
Yeah, they are definitely. So an adult and an older teenager, stroke symptoms can be more sudden in nature, but in a younger child, especially one less than 1 year of age, sometimes those symptoms can be more subtle. It can be all of a sudden having a different hand preference over time or a slight headache. So more sudden symptoms in older children or adults and more subtle symptoms in children, especially less than 1 year.
Well, and what happens? We come into the hospital. What do? You, as adults, you ask us a bunch of questions, and we're able to communicate with you, how we're feeling and how we've been feeling, and that's hard to do when you're talking to 2 and 3-year-olds.
It's really hard to do, and that's where you really lean on parents. And so I really commend Camden's parents, how great of a job they did describing his changes were really helpful for the medical team. And so we lean on parents all the time.
Yeah.
You know your child better than we do. And so that progression or those subtle nuances or changes is really helpful to
I'm
us.
glad you said that, because I was thinking the same thing. They did exactly what parents have. I think sometimes parents don't want to question doctors, or they don't know, what to do, what to say, and to be able to go in there and clearly communicate exactly what's going on with your kiddo. Cheryl wants to know, guys, did Camden have to be on any medication, and is he on any currently?
Yes, he had to be on Xarelto, which he is currently off of that and is on baby aspirin now. He had to take Keppra, and he'll be off of that the end of November. and he's on iron drops.
How long will he be on those? Doc, do we know about how long?
Yeah,
The iron drops, I'm not quite sure. But the Keppra, he'll be off of that at the end of the month.
Good, good. All right, Robert has a question, Dr. Sood, and I like this question because I think these two things get crossed here. But the difference between sedation and a medically induced coma,
Sure.
what is the difference?
Sure. So my job after Dr. Abraham does his procedures to keep Camden calm, especially while he has the breathing tube, and keep the pressures in his brain low. So sedation is any child is going to find it very irritable to have a breathing tube down their throat. And so sedation helps keep Camden calm while he's in the ICU. It's just medications to provide comfort. A medically induced coma is a barbiturate to help really calm the brain and really stop brain waves in just the most minimal amount of activity of brain waves possible to really shut down the brain. And so sedation is more for calmness to get through medically induced care.
Which you would need in a child's case many times. But
And then barbiturates or medically induced comas to really shut down the brain itself.
Makes sense. All right. I want to get our takeaways from you as well. What do you want folks who are listening to really take away from Camden's story?
Jess, I'm so glad you did this segment today, and thankful for Camden's parents and Camden to be here, just highlighting that strokes happen in children. You know, we think of this strokes and clots as something that happens to adults, but they do happen to children. And so trusting your gut, communicating to your provider about symptoms and signs you've seen that have changed in your child are really important, and just awareness that clots and strokes can happen in kids is really important because time is of the essence.
It really is. Time matters, and you're the one who brought this story to me, so thank you, because we talk about topics that affect a lot of people, but when something's rare, it's even more important to talk about so that people can know what to look for. So thank you for that. I want to get the takeaway from you guys. Amy, what do you want people to take away from this experience? And Bruce, same question.
Just watch your kids and pay attention to them, especially when they're sick. And hopefully this story helps other people.
Definitely. I mean, you really don't know how fast things can happen and how fast things can be taken away from you. And just love and cherish every moment that you have.
Really well said. Great words as we head out this week. And we just appreciate you just willing to share your story here with us today. We wish you well. And now you can get back to just being a big, happy family. So thank you, guys. We appreciate it. Hawk, let's get your final thought today.
Yeah, it's hard to follow that.
I know.
think that's the best advice going into the weekend. Other advice is if you haven't been vaccinated yet, please try to seek those vaccinations out, especially for influenza and COVID, and if you are over 60, of course, RSV as well. If you have those eye drops in your house, please take a look at the website or go to talk to your pharmacist about those as well. We want to keep everybody healthy and well throughout the weekend. Hopefully it will be nice and everybody can get out and enjoy themselves.
All right, Hawk, thanks so much. Thanks to all of our guests, and thanks to our viewers for being with us. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, Patrick Lampier had his prostate removed, but it wasn't enough to keep cancer at bay. I'm Jessica Lovell on the next Morning Medical Update, why he decided to switch doctors, plus the precision therapy he chose with minimal side effects. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.